So, mucopolysaccharidosis, or type 1, or Hurler syndrome, is the most severe, or the mucopolysaccharidosis um, diseases, of lysosomal diseases. Um, Lysosomal diseases, but Hurler is autosomal recessive. So, Hurler syndrome is one rare disease that is considered rare. Uh, is the most severe of the mucopolysaccharidosis type 1. It's a rare lysosomal storage disease characterized by skeletal abnormalities, cognitive impairment, heart disease, respiratory problems, enlarged liver and spleen, characteristic phases, and reduced life expectancy. The prevalence of Hurler syndrome subtype, it's 1 in 200,000. So Hurler syndrome there is a developmental delay that is evident by the end of the first year, and patients usually stop developing between ages 2 and 4. Hurler syndrome, they will stop developing between ages 2 and 4. This is followed by progressive mental decline and loss of physical skills. The language may be limited due to hearing loss and an enlarged tongue. In time, the clear layers of the cornea become clouded and the retinas may begin to degenerate. There is a carpal tunnel syndrome, or a similar compression of nerves elsewhere in the body, and restricted joint movement are common. Distinct facial features including flat face, depressed nasal bridge, and bulging forehead. They become more evident in the second year. By age 2, the ribs have widened and are oval-shaped. The liver, spleen, and heart are often enlarged. So, Hurler syndrome. Hurler syndrome, we're going to see some mnemonics. Try to remember. Okay, this is not mnemonics, but this is going to be actually the USMLE, some websites that have USMLE mnemonics. And remember, Hurler's syndrome, you can remember all the stuff that you will find, and each letter of Hurler's will be a letter for a word that will describe a patient with Hurler's syndrome. Hurler's: H, hepatosplenomegaly; U, ugly faces; U, because we are talking about a enlarged tongue and many things like that. It is the R in Hurler is recessive. The L, it's L-iduronidase deficiency. and you will see that in the pages that we're reading. There's a lack of alpha L iduronidase, which build up cause a buildup of glucosaminoglycans. So there are many lysozyme storage deficiencies. So a lysozyme, its function is to digest endosomal material via digestive enzymes. These digestive enzymes will be glycosylases, lipases, and proteases. Okay, all are acid hydrolases with functions of low pH. So low pH will destroy the whatever organism or whatever is inside of these ampules that contain digestive enzymes. These ampules, just to call them a name, will be glycosylases, lipases, and proteases. So all of these lysosomes are found in cells, and you will have higher concentration of these lysosomes in phagocytic cells. Now, you will have two types of forms of lysosomes, which will be primary and secondary. In primary lysosomes, you will have newly formed from the trans Golgi and waiting to receive endocytosed material. Now, the secondary lysosome is also known as a phagolysosome, and they are formed when the primary lysosome fuses with an endocytic vesicle. So the primary lysosomes are when they are newly formed and when they do not have any material endocytosed. The secondary lysosomes are known also as phagolysosomes, and they are formed when the lysosomes are fused with endocytic vesicles. Now, what is a lysosomal storage disease? By deficient enzymes. In lysosomal storage disorders, there will be different reasons why you could have a deficiency, a disorder. And I'm going to show right now a picture of these. Hexosaminidase A, the deficiency of this enzyme will cause one disease, hexosaminidase A. Next, alpha galactosidase A. Remember, ACE always has to do with what is going to break down. So galactosidase A is galactose. Sidase, which means one side of the galactose structure. So it's not breaking that side of the galactose. Glucocerebrosidase. This has to do with some kind of lipid because it has this cerebro suffix, glucocerebrosidase, so it's not breaking down this enzyme, this glucocerebroside. You see, beta glucosidase. And there's more, aryl sulfatase A, galactocerebrosidase, and sphingomyelinase. Each of these have one disease. So Tay-Sachs disease, we're gonna have to review it later in some other point, is hexosaminidase A. Hexosaminidase A. So when the GM, which is a it's a GM GM, let me see, glucosaminoglycan 2 ganglioside. When you don't have this hexosaminidase A to break down the GM2 ganglioside, you will have Tay-Sachs. Now, the glucocerebroside Gaucher, the deficiency glucocerebroside Gaucher. Okay. Now, Fabry, this is not, we're not even gonna see that, but Tay-Sachs, Gaucher, Niemann-Pick. Niemann-Pick is sphingomyelinase, and those are probably the ones that we care for right now. So here you can see on the screen sphingolipidosis. Sphingomyelinase is deficient in Niemann-Pick disease. Sphingomyelinase. Sphingomyelin accumulates. Histocytes look foamy. The presentation, what are you going to have in a patient with Niemann-Pick disease when there's an accumulation of sphingolipidosis? You will have hepatosplenomegaly, anemia, cherry red spots on macula, death by before 3 years, failure to thrive, neurodegeneration. It is inherited, autosomic recessive, and there is an increased risk, or you will see it a lot in patients with that are Ashkenazi Jews. What was the other one that you will see on Ashkenazi Jews? And there was another case that you will see. Oh, and that will be the dentinogenesis. No, dentin display. Actually, yes, dentinogenesis imperfecta type 3, also in Ashkenazis. Now, alpha galactoside A deficiency Fabry disease, peripheral neuropathy, hands and feet, angiokeratomas. This is very interesting, but we do not have the time to read it right now. Gaucher's disease, beta glucocerebrosidase deficiency in Gaucher's disease. Glucocerebroside accumulates in cells of phagocytic layer cells. Histiocytes, dendritic cells look like wrinkled tissue paper called Gaucher's cells. Anyway, we don't need to memorize all of that. We just need to know about Hunter's disease. Hunter's disease, there is a deficiency of iduronate sulfatase, what we saw, and it's a mucopolysaccharide problem. So all the ones we saw before was sphingolipidosis and Gaucher is also actually a mucopolysaccharide problem. Heparan sulfate and dermatan sulfate accumulates. The presentation, it's less severe than Hurler's. Oh, okay, yeah, that's Hurler's is the most aggressive. I'm gonna have to see a presentation on this. I'm gonna pause this and I'm gonna see a class of this.